Diet and hypertension. What is blood pressure? The force of blood against the wall of the arteries. Systolic as the heart beats. Diastolic, as the heart relaxes. Written as systolic over diastolic. Blood pressure classification. High blood pressure. A consistent blood pressure of 140/90ths of a millimeter Hg or higher is considered high blood pressure. It increases the risk for heart disease, kidney disease, and stroke. 1 out of 4 Americans have high BP. Has no warning signs or symptoms. High blood pressure increases your chance for getting heart disease and kidney disease or for having a stroke. It is especially dangerous because it has no warning signs or symptoms. It is estimated that 1 in every 4 Americans has high blood pressure. Once it develops, it can last a lifetime. Why is high blood pressure important? Makes the heart work too hard. Makes the walls of arteries hard. Increases risk for heart disease and stroke. Can cause heart failure, kidney disease, and blindness. How does high BP affect the body? How does it affect the body? The brain. High blood pressure is the most important risk factor for stroke. Can cause a break in a weakened blood vessel which then bleeds in the brain. High blood pressure is the most important risk factor for stroke. This can happen with a break in a weakened blood vessel which bleeds in the brain. A stroke can also happen when a blood clot blocks one of the narrowed arteries in the brain. The heart. High blood pressure is a major risk factor for heart attack. Is a #1 risk factor for congestive heart failure. High blood pressure is a major risk for heart attack. The arteries bring oxygen-carrying blood to the heart muscle. If the heart cannot get oxygen, chest pain known as angina can occur. If the flow of blood is blocked, a heart attack results. Hypertension is also the #1 risk factor for congestive heart failure, a condition in which the heart cannot pump enough blood to meet the body's needs. The kidneys act as filters to rid the body of wastes. High blood pressure can narrow and thicken the blood vessels. Waste builds up in the blood, can result in kidney damage. Kidneys act as filters to rid the body of waste. High blood pressure can narrow and thicken the blood vessels. This makes it hard on the kidneys, which will filter less blood. This results in waste buildup in the blood and may result in the kidneys' failure. The eyes can eventually cause blood vessels to break and bleed in the eye. Can result in blurred vision or even blindness. When BP is high for a long period of time, the small blood vessels in the eye undergo a number of changes. The vessels narrow and become constricted in places. Tiny amount of fluid leak from the blood vessels in the retina, the inside layer at the back of the eye. This is called hypertensive retinopathy. Hypertensive retinopathy often has no visual symptoms until it is quite severe. During an eye examination, the eyes are dilated to look for several findings on your retina. Flame hemorrhages, cotton wool spots, white fluffy areas caused by nerve fiber damage, hard exudates, lipid deposits from damaged blood vessels, swelling of the macula, central portion of the retina responsible for the center of your vision, and swelling of your optic nerve. The only treatment for hypertensive retinopathy is to control high blood pressure. The arteries causes arteries to harden. This in turn causes the kidneys and heart to work harder. Contributes to a number of problems. As people get older, arteries throughout the body harden, especially those in the heart, brain, and kidneys. This in turn causes the kidneys and heart to work harder and can contribute to a number of problems. Risk factors for high blood pressure: age, race, family history, obesity, inactivity, tobacco use, sodium intake, alcohol intake. Risk factors for high blood pressure: poor diet, high cholesterol, diabetes, kidney disease, insufficient sleep, sleep apnea, excessive working, greater than 40 hours/week. High blood pressure detection. Measured using a sphygmomanometer. 2 or more readings of 140/90ths of a millimeter Hg or higher taken on more than one occasion. Tips for ensuring accurate BP readings. Don't drink coffee or smoke cigarettes for 30 minutes before. Before test, sit for 5 minutes with back supported and feet flat on the ground. Test your arm on a table even with your heart. Wear short sleeves so your arm is exposed. Tips for having blood pressure taken. Go to the bathroom before test. A full bladder can affect BP readings. Get 2 readings and average the 2 of them. Ask the doctor or nurse to tell you the result in numbers and make a note of it. Calculate your risk. American Heart Association High Blood Pressure Risk Calculator, preventing hypertension. Adopt a healthy lifestyle by following a healthy eating pattern, maintaining a healthy weight, being physically active, limiting alcohol, quitting smoking. The best treatment is prevention. Dietary approaches to stop hypertension. Increase of 1 daily serving of veggies. Increase of 1 to 2 servings of fruit. Inclusion of 4 to 5 servings of nuts, seeds, and beans. Tips for reducing sodium. Buy fresh, plain frozen or canned no added salt veggies. Use fresh poultry, lean meat, and fish. Use herbs, spices, and salt-free seasonings at the table and while cooking. Choose convenience foods low in salt. Rinse canned foods to reduce sodium. The current recommendation is to consume less than 2.4 grams of sodium a day. 2 grams of sodium is equal to 1 teaspoon of salt. Americans consume on average 4,000 to 6,000 milligrams of sodium a day. For a person with high blood pressure, the doctor might recommend a 1,500 milligrams low sodium diet. Maintain healthy weight. Blood pressure rises as weight rises. Obesity is also a risk factor for heart disease. Even a few pounds of weight loss can reduce blood pressure. Being overweight is a risk for developing high blood pressure and other chronic diseases. Be physically active. Weight loss / healthy weight maintenance lowers blood pressure. 30 minutes daily of moderate level activity. Join a family-oriented gym or activity. Use stairs instead of the elevator. Park your car further away and walk. Start a walking club. Home fitness videos and web streams. Alcohol raises blood pressure and can harm liver, brain, and heart. Limit alcohol intake. Alcohol raises blood pressure and can harm liver, brain, and heart. What counts as a drink? 12 ounces beer, 5 ounces of wine, 1.5 ounces of 80 proof whiskey. Drink in moderation. For men, no more than 2 drinks per day. For women, no more than 1 drink per day. Quit smoking injures blood vessel walls. Speeds up process of hardening of the arteries. Damages lungs. Smoking cessation classes / resources, cdc.gov. Smoking injures blood vessel walls and speeds up the process of hardening of the arteries. The risk of having a heart attack is reduced after 1 year of cessation.